want to introduce Jamie and Celine. We're gathering on the dais, if you will, the
Wow.
metaphor for the physical in-person conference. And
Mm-hmm.
we will find other folks who are going to be, Zan is coming online to test. Dylan, hey, how are you?
Hey, Thomas, how you doing?
Dylan,
Hey,
say hi
everybody.
to
We are
Jamie
thrilled to
and
have
Celine.
you. Greatly appreciate your contribution to the conference. It's great.
You talking to me, Zan, or everybody?
Everybody.
Oh, yeah,
But sure, Dylan and Celine. Jamie, you're amazing. You have brought the world at its knees.
Well, we're trying. We're making good progress.
Or inside your big tent.
Yeah,
tell us.
Yeah, go ahead.
No, I was going to tell us, how did last month go?
Oh, you mean
I
the
dropped in
One
a
Shared
little
World
bit.
Summit? Yeah, it was
Yeah,
incredible. I mean, it just gets bigger and bigger. I was just off of a call. I don't know if you saw the part of our youth leaders. So we've been holding youth debates around the world for months in 40 different countries, where people were contributing to a specific plan to how to ensure clean water, basic sanitation and hygiene, and essential pandemic protection for everyone on Earth by 2030. And that all congealed into a model UN resolution that these young people from around the world negotiated. I got friends, former chief counsel of the UN, to help them. And then actually today we have a meeting that this language is actually being incorporated into a UN resolution that's moving through and towards likely passage by states. So we're really focusing on how do you go from kind of the big thing, which a lot of young people are doing, kind of consciousness raising, which is great, but it's kind of a dead end if that's all it is, to actually making specific plans to solve problems, and then doing global advocacy to actually turn those plans into reality. So it's been pretty cool.
It's amazing.
Quite
remarkable.
Can I ask you, Jamie, I mean, this was an idea, so I may be getting it wrong, but the pandemic happened. We're all looking around going, what can we do? Is there anything that we can help with?
Yeah.
And I have this impression you kind of came up with the idea, I don't know, let's say first quarter of 2020. You know,
oh yeah, no, you were there, Thomas. And I gave a talk.
No, I was a signer.
I gave a talk for Singularity, basically saying we're not focusing on the main problem. If we beat COVID-19 but don't beat pandemics, we haven't won. If we beat pandemics but not climate change, we haven't won. If we beat climate change but not nuclear war, we haven't won. And the common through line is we have global problems, but not global solutions. And unless we solve that problem, if we don't extinct ourselves one way, we'll do it the other way.
And I guess my question was, you have this impression now in October of 2021, how things have turned out since then. I didn't have a sense you had this grand 10-year strategy.
Yeah. So it's the best of times and the worst of times. I think we're recognized. People are more connected to each other than ever before, as evidenced by what we're doing now. And we are racing toward a new Cold War and dividing up the world into two megaspheres. And I'm a little bit part of it with my other work demanding accountability on COVID origins, which I think is essential. So there's some, as always, positive, encouraging signs and terrible, frightening signs. And it's a race between the two. And our job is to super empower the good stuff and work to minimize the bad stuff.
Yeah, and Jamie, you're all over the map, literally. I loved your segment on 60 Minutes. So, gosh, it's just amazing what you cover.
Well, thank you. It's there's just one life, and there's a big battle, and we all got to suit up.
I learned something sort of ties that bind, Jamie. We had a panel yesterday, I think it was day 2, with Zan, who is the fellow from Canada, Nova Scotia, Brendan Carr. And I think he advises a Toronto venture fund where he's talking to Daniel Kraft, your buddy from
having dinner with him tonight. Yeah.
Tell him that I guess we send our greetings, because his name was invoked when we were preparing for the emerging healthcare models session with Brendan Carr.
Okay, I'll mention.
I just want to say thank you to everybody. I'm going to be the audience here. And I know in the field of aging that I came from, the problem is everybody says everyone's old. And we're aging out of the field of aging. So we don't want that to happen in longevity and health span. So that's what you're doing here. So thanks for being here. It hit a great nerve for me personally.
Well, that is right. And that's why we have young folks, Celine and Dylan. And I hope we'll have Alison Hernandez join us in a moment. Alison is a fellow traveler, comrade in arms in this movement. She's on the Hill, was with former HS Secretary Donna Shalala, and now is with another congressman. But I think she will be on any moment.
She's actually in the audience. This is a call out for Alison. If you take the in-person metaphor here, Alison, we're calling you up to the stage. If you see an option to accept promotion.
Yep, there you go. Wow, that was magic.
She's walking right up to the stage.
And unmute yourself and put on your camera and say hi to the panelists, please.
Oh, there she is. Oh my gosh, what a background.
Wow. Yeah.
You've got the rotunda from the looking up.
You've got a camera right from below you.
Exactly.
You're doing a plank and you have a camera.
There you go.
I love that.
Yes, I get a lot of comments on this background, so it's a cute.
It also looks like a halo.
Right.
Exactly.
Yeah.
Exactly.
Has a religious element to it, right?
Yeah.
Keep
You
the
look
faith.
like a saint.
Yeah.
What's
Well,
nice.
Celine, great to have you and Dylan. You guys are obviously going to be chatting about your respective roles in the subject, and so we really look forward to your contributions.
I'm curious.
Oh, look at Jamie.
Oh, great. There you go.
Hey, Jamie.
That's going to play well.
All right.
Thomas made that connection with Brendan Carr. Do any of you know each other from any other venue? Because we are so proud of our silo breaking. Are you all meeting each other for the first time? Yeah.
Yeah, it
Looks
seems
like
like
it.
it.
Yeah, seems like it. Okay.
I note we're just less than 2 minutes to showtime. And
Zan, we didn't have a chance to, Zan, we didn't quite sort this out, but you've opened every day of the conference so far. So we're speculating that you and Adrian might start initially. And I think Adrian, we're also looking, Bronte, for
yeah, well, come on over from your stage, Adrian. And Thomas, you're going to stay in the village of Harper's Ferry, which is actually where we are, by the way.
World headquarters and also the broadcast central for the pandemic.
But yeah, we'll kick it off with about 19 seconds here. And then over to you, Thomas, and this great panel, which we're so proud of.
And was Hanadie?
Yeah, we're looking for Hanadie, and Bronte's on it. We've sent the scouts out.
I'm going to go grab a water. I'll be back in 10 seconds.
All right. Yeah. All right, we're at 9 o'clock Eastern Standard Time outside of Washington in the village of Harper's Ferry. We're coming to you the last day of targeting metabesity. And what a wonderful way to end it. We end with the future in mind. We've got a younger generation of folks that we are depending to take on the banner. And no one better to lead this group than Jamie Metzl, who Thomas will introduce in a moment. But Adrian, over to you.
I just want to introduce the rest of the day because this is an important day for us. we call it the Emerging Companies Showcase. And you will see some startup companies in the field of metabesity, 3 excellent moderators who really know the world of investing. And it's going to be our own version of the Shark Tank. Also, you will be getting $1 million. Yes, they'll be virtual, but it's $1 million. I will give you all the instructions after this terrific panel on how you can invest. And every one of you that participates in this little investment in metabesity game will get a prize. What prize? Well, go to the bookstore and you'll see all the wonderful books our speakers wrote, and one of those will be yours.
Terrific,
Thomas,
Adrian.
Thomas.
Thomas, over to you.
Thanks, everyone. It's my pleasure to introduce this panel. It's how to recruit Gen Z and Millennials to the goal of healthy longevity for all. It stems from a hand striking the palm moment when we looked around at people working on metabesity and realized that many or most of us were aging boomers, and realized that healthy longevity is a matter for all generations, not just those who have had the chance to experience intimations of mortality. I don't know. And so we thought that, and the other thing is that within the longevity field, there are people who have been very young people who've been struck with the subject early on. So we need to find a way to ensure that we can reach all generations. Not just that, Jamie, who's an alumnus speaker for us at Metabesity, he's a best-selling author, Hacking Darwin. He's a public intellectual, too many things. I can't name all the things that you've done, Jamie, but one thing that he's done during this pandemic period is to start up from scratch a movement, a one shared world. You can look it up on the web, which within 6 months he was able to take to an inaugural summit with more than a million people attending, including the Dalai Lama, WHO officials, and so forth. And just last month, he held his second summit with over 3 million. So we're saying that, with this conference, we're going to reach thousands, but that's not quite in the same league. I'd love to see a way to figure out how we can bring 3 logs more people to the cause, to the movement of healthy longevity. So let me throw the mic over to Jamie Metzl. Jamie, take it away, please.
Wonderful. Thanks so much, Thomas. Thank you, Zan and Adrian. And thanks to all of you. This has been a really great conversation, and it's what I have seen over the years now of connecting with this event and with all of you, is that we're building something, and we're building a field, we're building a consciousness, and to build anything, we need to make sure that we are engaging people of all backgrounds, of all generations, because the only way we're going to grow is by everybody recognizing that they are stakeholders in our success. In many parts of the world, people see the field of life extension as something that super rich people in Silicon Valley do to cheat a few years of life. And even if that's the case, there's nothing wrong with that. I mean, it doesn't harm everybody else. But I believe, and it's connected to our theme of what we're talking about, what we will talk about in our session here this morning, that the field of healthy longevity is something much bigger, and it's broader, and it's more idealistic. And I feel that we have to reframe what it is we're doing and why. And by doing so, we'll be able to engage many more stakeholders, including younger people around the world who will see this as part of their drive to build a safer future for everyone. And I think that is the key. So even in the earliest days of the pandemic, Nir Barzilai and we wrote an editorial talking about the field of extending healthy human lifespan. That when we saw that the SARS-CoV-2 virus seemed to be discriminating against older people, one of the obvious strategies for fighting back was to make the bodies of everybody feel that they were younger, to feel biologically younger. And so all of the work that everybody had done in this field was part and had to be part of that conversation of how do we build greater resilience into our human population. Again, has nothing to do with helping Elon Musk and Jeff Bezos live longer, and everything to do with how do we fight this terrible scourge that is taking so many millions of people now from us. Another way that people look at actually the same information with different possible outcomes is when we think about, well, what do we even mean by life extension? And yes, we certainly mean that healthy people in developed countries can live healthier longer. And again, that's a fantastic, wonderful aspiration that we all should have, because if people live longer, it means more love, more poetry, more babysitting, more innovation, more of all of these things that we want and should want. But if we see extending healthy human lifespan as extending average human lifespan, which we should, that could lead us also to broadening our scope, not just of what we're doing, not just of who we consider part of this field, but of what we see as the essential mission and contribution of our work. Because separate from the radical science of human life extension, we already have a pretty good formula for how people on average can live longer. And it's all the things that we did over the course of the 20th century: clean water, basic sanitation, basic public health and healthcare, workplace safety, all of these things that have driven the massive expansion in lifespan and healthy lifespan over the 20th century, more in the developed world than in the developing world, but unevenly, even in the developed world. What we also need to do, we need to recognize that part of this field must be extending average healthy human lifespan. And if we can broaden that, if we can broaden the scope of what we're doing, I believe the sky is the limit, because we will have so many natural allies who won't feel that they are just joining an effort that's purely scientific or something that will only benefit a very narrow set of people, at least in our lifetimes, but they're joining something that is and has the potential to be truly idealistic. And because the voices of that idealism now and probably for all of human history are younger people, that's why I think this session is so important in itself, and it's so important as to draw us toward the conclusion of this important summit. So we have some really fantastic speakers, and what I would like to do is to ask each of our speakers, Celine, Dylan, and Hanadie, nice to see you. Hanadie just joined us. Dylan, Celine, Hanadie, and Alison, to each speak for about 5 minutes, framing your core issues. And if you don't mind, just do, I think everybody has it in their program materials, but just start with a 1-sentence reminder introduction of yourself. And then we'll come together and we will have a conversation. So if that works for everybody, who should go first? Maybe Celine, do you want to go first?
Sure. Sorry, so just so I understand, you want me to talk about my general opinions on Gen Z, millennials, and aging, in addition to myself? Yes,
say a little bit about yourself, and then you have 5 or so minutes on your general views on Gen Z and aging, and how, more specifically, how can we fully engage Gen Z populations? Because as Thomas said, it's not just about you have to feel your mortality. There's something maybe much more idealistic in what we're ultimately doing here.
Yeah, so hi, I'm Celine Halioua. I'm the founder and CEO of a company called Loyal. We're developing drugs to extend dog lifespan and health span, and as you can probably understand, also using that to make our way towards human aging drugs too. I believe that going dogs first is one of the better ways potentially to get the first ever human aging drug approved. And our wonderful VP of Aging Bio, Michael, will be talking later on some of the science. So I will defer to him for all of that. And I guess why I'm an quote unquote expert on Gen Z and millennials, because I am 27 years old. I entered the field when I was 18. I worked under Laura Deming, who's obviously started the field very young. I employ a lot of Gen Z millennials, who are about 35 people. And yeah, I have a lot of opinions on this stuff. I think the very first thing I would say is the importance of narratives. I will point out that kind of in the pre-chat and now you guys have multiple times said things like, oh, you have to feel mortality or you have to be in aging. That's what your driver was. I think that's actually projecting potentially what the drivers of some people in this audience are versus the drivers of us. I'm actually personally not driven at all by my mortality. That's not why I work on aging. It's not why I care about aging. I think a lot of younger people don't even like think about aging or aging interventions for themselves, or at least I don't. I don't take my own drugs, right? I'm working on aging purely because it seems to me the most logical and effective way to treat multiple age-related diseases that are hurting people, right? I'm working on it because it's another scientific field and it's a scientific niche that I think is the most relevant to the diseases and the problem areas that I care about. So I guess my first point would be to be very careful about the narratives that one uses when describing aging, because I think it actually accidentally becomes exclusionary to people who might be very interested in the biology of aging and very interested in the science behind aging and the challenge that aging brings and the regulatory challenges and the structural challenges and operational challenges and commercialization challenges. It's actually a very fascinating area to work. But if you make it about mortality and if you make it about 1,000-year lifespans, if you make it about avoiding geriatricness and all of these things, then you're automatically going to exclude a portion of people who are going to say, oh, I'm not interested in that. I'm not doing this for myself. I'm not, I'm just looking for like a really interesting problem to put my brain on. I think that's something that Laura actually did super well. One of the reasons why Laura was super successful is because she gave people who are interested in aging somewhere to invest their money and their time that wasn't also a brand risk and didn't also associate with these kind of like controversial questions and narratives. So that would be my first one. My second one, and I'm not going to like get into this too much. I really don't want to talk about it a lot, but I'm sure people have seen what happened with Aubrey de Grey. That was me and Laura. We were the ones who came forward. And I will just put a couple sentences to just say that there cannot be a tolerance of bad actors. I think there is obviously like short-term negatives of bad actors, but it also reflects on the field in general, right? So I actually almost left the aging field and longevity field entirely because I assumed the entirety of the field was corrupt at the core because it was okay with tolerating this type of stuff. And so that obviously is not true, but I didn't know that as a young person, right? I only had my very little exposure to what the field is like and what the representatives that I was exposed to were like. So I think as the field matures, there will be this responsibility to really have this insanely high quality bar of who we do and don't allow to represent the ideas forward to the next generation. And then the third thing I'd say, and I really don't want to monologue for 5 minutes, is that I think there's an importance of indexing off of competency and off of execution and not off of letters behind your name or titles or years spent on the field. We'll be able to talk more about what we've done at Loyal over the next year or so and start publishing some of our work, but I can guarantee that we've done a lot of things that are definitely not been done in the field before and will benefit everybody in the aging field. And I dropped out of my PhD, right? And to be clear, I hire and employ and support people who have, have decades of aging research, but it's not always about that. It's more about kind of bringing together the right people and, being truth seeking for what is the answer you're trying to go to and what's the problem you're trying to solve, and not kind of falling back on old norms. So one of the reasons why people who are like younger like to work for me is I don't care. Like I care about your ideas and how good of a thinker you are. I don't care about where you went to school. I don't care what the letters behind your name. I just care about working on the problem and the competency that one has. And that seems like very obvious when you say it, but if you go into more traditional institutions, traditional pharma companies, traditional academia, it actually is really not the case. I always like to quote how like when I was at Oxford, I got in trouble because I talked to somebody who was 2 levels above me, and I was insulting to the person who was 1 level above me. Right. These kind of things like are already not a thing in tech anymore, in other industries where millennials do go. And so it's really important that the rest of the industry starts modernizing also if we want to have more people working on problems like this.
Great. Thank you so much, Celine. And also, I think on behalf of everybody, thank you for coming forward on the Aubrey stuff. I mean, I think that for this field, for every field, we need to create environments where people are empowered to speak up, where good behavior is rewarded and lauded, and bad behavior is very, very quickly identified, because it's about a lot of things. But I completely agree with you, Celine. The way I imagine progress, it's like birds in flight. It doesn't mean that any one age cohort or background cohort should be in the lead bird at all the time. We just need to keep switching around so that we can get where we're going as quickly as possible. So thank you for that, Celine. Dylan, over to you.
Sure. Thank you. Thank you, Jamie. Hey, everyone. It's great to be on this panel. And just a quick intro. My name is Dylan Livingston, and I'm the founder and president of the Alliance for Longevity Initiatives. A4LI is the first and only 501c4 organization advocating politically for the longevity community. So in the chat, I just saw that Thomas wanted us to kind of touch on how we got involved in longevity. And I have two kind of responses, one a personal response and one more of a career response. The first is COVID, and I think COVID kind of woke everybody up to some extent. But you know, I was living in New York at the time. I was right outside of New York City, and you know, anybody who lived in New York City or outside during March and April of 2020 can attest to the fact that it was not a great place to be. Specifically, though, I was living with my grandfather, who's in his mid-90s now, and he struggled mightily with COVID. Not only himself, you know, thankfully he was okay and is okay, but watching his friends and generational cohort in general get devastated by a disease that, you know, if I got as a 23-year-old, I would be fine from. So, you know, that along with the, you know, hearing sirens wail in the distance and, you know, getting that next text of who has COVID in the neighborhood now, you know, all of that really kind of disturbed me really, and really made me feel uncomfortable about the fact that we're all aging, right? And I came to the realization that age is the #1 comorbidity for COVID. And, you know, that led me to, you know, the Metabesity kind of mindset of, you know, age is the, you know, driver of all late life diseases, right? And, you know, I want to avoid that for myself. So Celine, I can't, you know, I'm not on that same wavelength as you. It definitely is a personal thing for me that got me back into longevity, you know, realizing my mortality and realizing the mortality of the people around me. At the time also, I just want to say I was in the middle of a budding political career. I was working for the Biden campaign when I had this reinvigorated passion for longevity. After my time with the Biden campaign, I was kind of looking for my next opportunity, and I realized I had a chance to marry my passion for longevity and you know, my background in politics and political organizing, and so I created the Alliance for Longevity Initiatives, 501c4, which I just mentioned. So, you know, while COVID inspired me personally to get back in the field, you know, a field that I have known about longevity as a subject since I was, you know, maybe 10 or 12, just, you know, from the OG types like Ray Kurzweil, right? You know, that's how I found out about it. But COVID really kind of, you know, rewired some wires in my brain and got me back into this movement. And then realizing, you know, the lack of political action around longevity really got me, you know, focused on this as my career path. You know, this is a void that we need to fill and, you know, get active in. So I'll pass it off there.
Perfect. Thank you so much, Dylan. Hanadie.
Hi, Jamie. First of all, it's a pleasure and really an honor to be on this panel today. It's been an amazing last 3 days of Metabesity, and I will also be really excited to present more about Juvena Therapeutics later today at the Emerging Company panel or showcase. So a little bit more about myself. My name is Hanadie Yousef. I am CEO and co-founder of Juvena Therapeutics, which is a regenerative medicine biopharma startup dedicated to developing protein-based therapeutics that can promote tissue regeneration, ultimately in order to treat a variety of both age-related and rare degenerative diseases. And we're doing this through having established a really robust machine learning enhanced protein drug discovery and preclinical development platform. I'm in my mid-30s, so I'm actually pretty honored to be considered a young person. And what really motivated me about dedicating my life to the field of health span and regenerative medicine was, you know, first starting in my teen years, I started doing research at what was at the time a rapidly growing but small biotech startup called Regeneron Pharmaceuticals. I was actually mentored by two really amazing female scientists that inspired me to really fall in love with biomedical research, drug discovery and development, and want to tackle major degenerative diseases. But at the time, I was actually really interested in cancer and gene therapy. And it wasn't until the end of my first year of graduate school where I met my co-thesis advisor, Professor Irina Conboy. I was taking a course with her on, and Mike Conboy, on stem cells and directed organogenesis, and really fell in love with this just concept that by understanding the mechanisms underlying the biology of aging, and specifically how protein signaling in our body declines or changes, I should say, in expression with age, leading to loss of tissue homeostasis and decline of stem cell function, we could actually target those mechanisms and pathways to revitalize our own body's stem cell function, to promote better regeneration, repair, and even reverse the aging process. And so I really fell in love with that and decided that that was what I was going to dedicate my career to. What was also really driving my passion in wanting to identify, understand, and then develop therapies that can target the biology of aging to reverse it and really promote health and regeneration was really seeing my parents and my grandparents and my aunts and uncles really start to deteriorate. Once folks in my family, and I think what we all experience this, hit our 50s, seems to be just like this downhill where suddenly we'll get multiple comorbidities, age-induced diabetes, cardiovascular issues, heart attack, stroke, cancer, and more, leading to ultimately, I feel like, a loss of health span and really sort of the start of sick care, leading eventually to our mortality. And so it's always been now my goal to really develop a process and a methodology in therapeutics and interventions that can ensure that everyone has a chance to live as centenarians do, right? Maybe into our hundreds, where we really gracefully age and really, though, through the whole process, really can maintain our health and really continue to live life to the fullest. And so that's what's really inspired me to really dedicate my time and resources towards building a company and a platform and pipeline, ultimately, of therapeutics that can promote that well-being and health span for everybody. You're muted, Jamie.
Jamie, you're muted.
Oh, there we go. What I was saying was, that's great. Thank you so much. And my apologies for mispronouncing your name. So Alison, you're within the government, and for everything that we're talking about, there needs to be an interaction between me to weave together all of these different things: the science, the community, the regulatory frameworks, the incentives, the business opportunities. Talk a little bit about your work.
Sure. Yeah. Thank you again for having me. It's great to be part of this panel, and I like nothing more than to talk about these topics. So I'm really glad to be here today. So my name's Alison. I am a health legislative assistant in the U.S. House of Representatives here in Washington, D.C. Obviously, talking on behalf of myself today and not the member of Congress that I work for. But I'm glad Jamie kind of led into what I do with his comments, because it's true. What attracted me to come to work as a staffer, because my background is in healthcare. I'm a registered nurse by practice. I have my PhD in nursing, so I did research. So policy was sort of the trifecta, right? It is my clinical work and my research work that made me realize that policy has to be kind of at the core of all of the things we want to do, move, and shake. And that's what motivated me to come to Washington, D.C. It's true, policy does move everything forward, but I think something really important, and I'll kind of backtrack to what got me interested in aging, because it leads into Jamie's question, which is, number one, I've always had an extraordinary connection with my grandmother. And I think that's not something unique to me, but definitely unique amongst a lot of my colleagues and peers, and not something that everyone can have. So I definitely think my passion started there. But my interest really developed because, I think we all love the idea of a marathoner centenarian and learning and reading about the blue zones in the world where people with very to like no disability, live till 100. And reading about those things really got me excited as to like, how can we all be this way, right? And I have to say, at that point, I felt a bit naive about the reality of the world. But that's what got me interested in research, really. And a lot of my research focused on how we can promote psychological well-being and physical activity and just whole body well-being as we age. Fast forward to when I got interested in policy, I realized, well, how do we legislate those things, right? How do I legislate people being happier, people having better lives, healthier lives? And I've honestly come to the realization that it is in the cumulative work of how, as a country, we prioritize and invest our monies, and specifically in terms of at least the work that I've been doing, focusing on the social determinants of health. For me, it's been not that I didn't understand that before, but a really true awakening that, housing, having affordable housing as we age, having a safe place to live, social isolation and loneliness is something that, I'm being a little bit facetious here, but, we can't necessarily cure with a medication, right? Or we can't change that, that we have to keep investing robustly in care, not only in the home as we get older, but also in an institutional setting, because the reality, and again, is that everyone here might have to spend 1 or 2 days in a nursing home at some point of our lives. Of course, hopefully with all the technologies we're talking about during this panel and also during the conference, that might be less of the case. But I am really invested because I know that is my future. And I don't mean that in a negative sense. I mean it in the sense that we want those things to be great by the time our generation and younger generations are approaching. On a very practical level, I think younger generations, and I see this a lot, even talking to older members of Congress, is there's a lack of understanding of what it costs to get older, that Medicare doesn't cover long-term care, right? And how we can plant that seed earlier on. And most importantly, I think, and maybe I'm jumping the gun here, but I think politically speaking and policy speaking, younger generations, millennials, Gen Z, going back, we have to tie the issue of aging well to issues that these generations care deeply about. So think like climate change would be like my number one thing, because even with COVID, right? I mean, the press talked about older adults being, the ones that were at like the crux of the pandemic and suffering the most and the most deaths. But even on the political and press side, like it still wasn't something that was causing a lot of alarm and alert in terms of like what we could politically hinge ourselves on. So I think tying it to issues like climate change, issues of equity, I think younger generations are very focused on those things. And I guess stop there. My last comment will be that, and this is just my soapbox, ageism continues to be the only ism that's still kind of like cooler, water cooler talk appropriate. And that's also something I believe we have to work on reframing and changing. So thank you, and I'll stop there.
That's great. Thank you so much, Alison. And I think, was that your dog making those noises in the background? I think.
Perfect timing.
No, but because I actually speak dog. And the dog was saying, don't forget to link what you're saying to what Celine said in her remarks in the beginning. So I'm glad that as we talk about inclusion, it's not just human inclusion, but others. So why don't we start? So I think the crux of what we're talking about here is, how do we build this community? How do we broaden this community so that different kinds of people can see their own aspirations in this work and in this field? And as we've heard here, there are many different but highly complementary reasons why people would want to be involved with them. But I certainly think that for Gen X, Gen Z, and really most of everybody, selfishness is not a narrative that anybody can rally around. We all have our own desires for ourselves, but I think for this field to really take off, it has to be connected to a story that people can buy into. So Celine I thought you were very clear in your comments that to build community, we have to articulate what we're doing. Oftentimes, at least that I have found as somebody who kind of has like one foot in the science world and the other foot in other worlds, the scientists do a great job at science. They're trained to do a great job at science. Some of them are great storytellers and formers of narrative and communicators, but often it's just a happy coincidence. It's not the core of what scientists are trained to do. And part of what we're talking about, I mean, we couldn't have this conversation. If we had this conversation before the science made any of this even seem realizable, it would be I'm also a science fiction writer, but it would be in the conferences of science fiction writers. Like when we're talking about, well, let's travel outside the solar system. Someday it could happen, it's just far away. So we are at this moment where the science is making a lot of things real, potentially real, seem real. Time will tell. So I'd love to get people's thoughts on if we want to broaden out this narrative so that many different kinds of people can see their best selves in this work. What are some of your ideas about how we might best do that? Celine, because you initially brought up the issue of narrative, maybe you can go first.
Yeah, so I think the way that, well, I think there needs to be a clarity in like what we want to have people thinking about the aging field. So not to break, I think it was Thomas, but not to break your heart, Thomas. I would suggest that potentially like the goal would not be getting, everyone necessarily at like the, this is a very like legitimate science focused conference that is like has a panel on this, but it's really more about the science, right? And I wouldn't necessarily suggest the goal is not to get people in these rooms necessarily, because you do need scientists, but you also need everything else. I think it's more about getting people centered around a certain narrative and then understanding how to communicate that narrative well. So like one of the like meta theses of Loyal was that by working on dogs, this was actually a less controversial, more friendly, fluffy, whatever way to introduce the aging thesis. It's like a honeypot for PR attention. Honestly, we get a lot of press, and it's the only way I can think of describing this is it's like making aging sexy again, right? Like basically, like can you make working on aging as cool, as interesting, as like socially relevant as like working on space is now. Like SpaceX, like working on space engineering and rocket engineering is exceedingly difficult too, right? But people really want to go into this field because it honestly, for a number of reasons, but it's also just built a very, very good brand. So I think really the most important thing to focus on is understanding what is the field of aging's public brand and how do we get people interested in it. And then some of those people opt into coming to conferences like this because they want to work on the scientific side. Others will work on going the regulatory side or policy side, or just be operators who want to work on aging or engineers who want to work on aging. We shouldn't really like be prescriptive of where they want to go. I think it's just more about mastering the narrative first, which historically I think the aging field has really struggled with.
Yeah. So let's I think it's great, and let's keep digging because one is absolutely there needs to be a more inclusive and comprehensive narrative beyond the science is cool, which it is. But let's start doing it. I mean, let's start articulating what might those messages be. I mean, we're all in this world. We're all having lots of conversations, lots of interactions with social media, other people, and people outside of this field. What might some of those meta narratives be that you guys feel would be more engaging and more inclusive? Dylan.
Yeah, I can speak on that a little bit, just from a political side. And this is more in line with what I'm trying to do with A for LI. But making longevity a political issue, a political topic that is discussed in the halls of Congress and discussed, in before voting and things like that is important, right? Specifically talking about Gen Z and Gen Y, which, by the way, I don't know what I really qualify as here, but I guess since I'm the youngest, I'll be a Gen Zer, but I like to play the both card. But anyways, young people are passionate about, politics and political issues. So, we need to make longevity a political issue on par with, climate change, gun rights, marijuana rights, abortion rights. Every, one of these kind of industries, kind of these issues has an advocacy group, right? And cough, cough, hint, hint, a 501c4 advocacy group that can do plenty of things and, back candidates who want to run as a pro-longevity candidate. Politically, though, what we're trying to do is try to change the narrative away from, this is about, extending a lifespan radically, and more show politicians and the public that this is just another step of medicine. This is just, this is no different than, coming out with cancer, cancer treatments back in the 80s and 90s, and no different than the polio vaccines of, I don't know, the 50s and 60s, right? This is just advancing medicine to help people live longer and healthier. So the messaging that we're trying to push out at A4LI is, this is nothing new. This is, just a next step in the evolution of, our species. And, there's no reason to push against it other than, illogical kind of thoughts in your head, right? That, everybody wants to live in more comfortable refinement for a better and more longer amount of time. So, why deny that? And, I think once we kind of make it, a lot more digestible for people and make people realize that this is something that has been going on and will continue to go on, the message and the narrative will change to one that is more normalized and less, fringy. And, I think that's what we're trying to do politically, try to make this, really an issue that both Republicans and Democrats care about, and, is not just an issue on the fringes.
Yeah, and maybe there's even a little bit of a conflict between the use of the term longevity and the use of the term healthy aging, because longevity, just people hear it, it means helping people live longer. And then that was this transition that we've all been part of lifespan to health span. Mm-hmm. But when people hear about healthy aging, about resilience, then I think that's very comfortable. People are like, oh yeah, that's a good thing. When people hear longevity, they think about Elon Musk and Walt Disney freezing himself. And I think that, it feels like a not me kind of thing when the goal is for people to say, well, this is something that I'd like to invest in, because I know that everybody I know is going to have aging issues and these comorbidities. And so right now, everybody is fully on board with fighting cancer. And if you meet somebody and they say, I'm against fighting cancer, you think like, oh, this person's a jerk, just because everybody is on board. But not everybody feels that way about healthy aging, even though they would if we sat them down and kind of explained the comorbidities of aging, and that addressing each one of these morbidities is like playing whack-a-mole, because they are connected to each other. So how do we make the field, the conversation, I should say, about healthy aging feel to people more like it's about, well, let's fight breast cancer, or let's fight cancer or dementia, and less like let's help Elon live a few extra years. Hanadie or Alison, any thoughts?
Sure, Jamie. Happy to address a couple of those comments. First, I couldn't agree more with you that it's really important to really ultimately educate the public and the global population on the fact that we have a looming healthcare crisis, right? The largest growing demographic of folks on planet Earth are those over the age of 60. The World Health Organization estimates that by 2050, there'll be over 2 billion people over the age of 60 alive. And it's aging itself that is leading to multiple comorbidities and chronic degenerative diseases with no really approved therapeutics that can treat and cure and reverse, those diseases, as opposed to just treating symptoms, which is what's going to cause this healthcare burden. So I think some of that education could be through, really strong lobbying groups, right? Having things like commercials and, ads and features and all the kind of major media news outlets, really using social media platforms. And then ultimately, I think in terms of honing in that messaging from a very young age, I think we need to really have an aging biology focused curriculum in school, starting from even grade school, where students and kids are even taught, they like what they're eating now and their lifestyle and health choices and sort of that kind of societal aspect of things will in fact potentially lead to unhealthy aging and to really chronic illnesses, and that there is a way to prevent it, not just from waiting to take that magic pill when you're older, but even in doing things like exercise and better diet and, understanding sort of leveraging a balance between sort of the digital age and going out and playing and kind of moving. So I think, really tackling it at multiple levels, but ultimately it's an education goal and something that we really need lobbyists to work on to get that messaging across.
I think it's great, excuse me, and it's really important because if we could turn exercise and healthy diet into a pill, people would attack their pharmacies and kill all of their neighbors to get it. And yet we haven't been able to communicate. And I think the more that this work and the work, even the scientific work of extending healthy human lifespan is seen on that spectrum, the more people will feel it feels familiar, like something that is for all of us that we all can support. So I definitely think that we need a lot of advocacy, but to get to that point of advocacy, coming back to Celine's original point, we need to have a framing that makes advocacy possible. And I think that's the challenge. And I think this community is a great one to do it. And like Thomas said, with One Shared World, you're getting it right when a bunch of people who you don't know are kind of repeating or making their own the framing that you've struggled to get right. I think that's where we are now. We have this community. Those of us who are in the community, we get it. We get why it's important, but we need to create something like maybe we learn from the virus. The virus, it's not like a carnivore. It's not like a lion that has to chase down every zebra. It's figured out what's the core piece of information that can get the rest of the world to do its work. And I think that we don't have that yet in this field, but it's fully achievable. And I think that that's an important goal for us.
Yeah.
Allison. Oh, sorry.
Sorry, go Allison.
Okay, Allison and then Celine.
Sure. I want to comment. There's someone in the chat that wrote about the, changing the culture, right? I come back to this all the time. And again, I hate to be very cynical, but we do live right now in a country where we don't see getting old as a good thing, right? And where the way our society is built and the way families work, maybe here all of us can say that we've had a lot of contact, like I was talking earlier, with people who are older in our lives very intimately. But usually, right, you're born, you work, you get older, and then you kind of become obsolete. This is how I feel that a lot of people think in our culture. I don't like to generalize, but I think a lot of other places in the world think differently. So how do we get to put more value on what is the intrinsic value and meaning of having a robust aging population, right? So rethinking there. And I always like to say in terms of messaging on social media and talking to folks is that aging, we're a country that in a positive sense prides itself on diversity, right? And we're a melting pot of people, and aging is a diversity factor. Working in a workplace with varying ages, people of different ages is very enriching, and being able to live in a building that's with a plethora of people from different ages is really enriching. So different ways of thinking about how we can reframe aging from it's just another way of being different, but not in a bad way, but in a truly great way. And so I don't know if that's helpful or not, but I feel like at least with younger generations and people who I talk to on a daily, that message sometimes resonates a little better. than just being like, we should care because we're all headed that way. And the other point I just wanted to make on the education piece, I think the financial literacy of what it means to get older and what kind of, financial investment you need to make in yourself and your family as you get older is something that's sorely missing at a younger age. Not only we should exercise and you should think about not wanting to get chronic health conditions, but just the amount of foresight you need in thinking about saving for retirement and making sure that you are taken care of at some point of your life when you no longer can be in the workforce. And so I think a lot of that, I would say every college education or every college student should have like a basic finance and econ class 101, no matter what your major is. And this is a perfect place where you could tie in a lot about financial literacy as you get older and how to save for long-term needs.
Yeah. Celine.
Yeah, sorry, Alan, didn't mean to interrupt you. What I was going to say is in my opinion, this is a little bit of a false exercise, because what's actually going to work is results. Like, that is how you get people excited about aging. It's when you have a visual, shocking demonstrations of efficacy. And I don't think anything before that is really, we can we try to make these perfect sentences, but how Laura raised her first longevity fund? She had these things, right? She had the economic impact of aging. She had that we're all aging, it didn't work. What did work is she had a slide that had the P16 Incotac mouse before and after the KO. So basically it was a selective ablation of senescent cells in the mouse. And it's a 2 sibling mice, one where one did and one didn't. And if you Google it, the one who didn't have the senescent cells removed was old and didn't look healthy and had cataracts and was balding, and the one who did was a healthy looking mouse despite being the same age as the decrepit mouse, right? That slide is what helped her raise that amount of money, and that's her doing that is what helped facilitate a whole nother generation of aging work. So I do think these narratives are important. I do think they are relevant. They are definitely relevant for certain populations, but if you want broad interest in the aging field, honestly, it has to be simpler. It needs to be visual. It needs to be sexy. It needs to be interesting. It needs to be provocative in a not controversial way, but more in a, wow, look what I saw today. And that, in my opinion, is how we get more people in. And otherwise, I think we're kind of projecting what our personal interests are in the field more than what the average person cares about, which is, probably not. They don't care about health on average, right?
So yeah, I think it's a great point. But let me lovingly push back a little bit, because we already have that slide. I mean, we already have that slide when you see different people in different communities in our countries, in different countries around the world, have radically different life and health spans, not because of differences in their biology, but because of all of these other factors. And I will say, there is nothing that we will achieve in science over the course, I would guess, of all of our lifetimes that will match the difference that all these other factors make between the people who are individually and collectively living longer and individually and collectively living shorter in our world. That doesn't mean I'm not a huge believer and also an investor in the science of human life extension. And certainly we're seeing it, and we see it in all these model organisms. And if you want to live, you have radical life extension, be a roundworm. It's your best bet. And we'll have it, and we'll have these things. And so while I do think that part of what we need to do is get people excited about the science, and some of it is I mean, it's at different levels, and that's why the TAME and something just as simple as metformin, there are other things of that are much more aggressive. It's all real, and we need to build this field. But the more that the field, in my view, is built around this continuum between all of these really simple things that we can do. And I really liked what you said, Alison, and not just about financial literacy, but about just, it's hard for all of us at any stage to imagine the continuity of our lives, let alone make decisions about a future that's unreal and abstract to us. But the more that we can see that, I think it will help all of these things, including the investment in and support for even the most aggressive science. Hanadie.
Yeah, and just to kind of add to that, I also think we need to, really make sure we get our messaging out, but also be careful about that messaging and ensure that it's not, we're not trying to sell things like, snake oil, right? I think in the end of the day, it's going to take a village, not any one individual, and a multidimensional really approach to educating the public and to really getting multiple aging interventions out there on the market for people to really improve lives slowly but surely. And so, as much as, visuals and things can be striking, especially for investors, I think ultimately it's really important to make sure that we just start getting folks to think about it and to realize that, yes, there's amazing interventions and scientifically that might have happened in genetic mice, but it's going to take an effort and the society to really ensure that we can get these products safely and cost effectively and efficiently to people to really make a difference in their lives.
Yeah, that's great. Alison.
Oh.
Well, Alison, then Dylan. Yeah, sorry.
One quick comment again on my sort of cynical side of things. So I did the Health and Aging Policy Fellowship, which is what brought me to the Hill, and in it is a cadre of people who are eminences in geriatrics and all sorts of aging related issues and practices. And there's one physician that always says, I can prescribe a life-saving medication that will bankrupt someone, but I cannot prescribe them food. I cannot prescribe them housing. So, and I'm saying this is because her call to action, similar to the messaging and reframing of getting older, is that we have to ask the unconventional people in our culture and society to help us find the right solution. So social workers, the engineers, and these are all things, and I know we're not just talking about the medical or biological sciences, but I do think, and someone mentioned this earlier, that we have to look to the broader workforce and experts to solve these questions and reframe and get like really at the problem and not just rely sort of on the medical side of things, right? Asking physicians to solve aging or creating more medications that can help sustain life. So again, just a soapbox moment, but I wanted to hammer on that because I think it's a good point that we need a diversity in thought to solve these issues.
Great point. Dylan?
Yeah, so we have a few more minutes here, so I just want to circle back to what the original title of this talk is, and that's Recruiting Gen Z and Gen Y. And I just wanted to touch on something on that point. So, we need to go where Gen Z and Gen Y people are. And, that's obviously social media, but, what social media and how do they, consume their content is an important thing, especially if we want to, really, go viral on social media, right? I just to clarify, I'm not a huge social media guy myself, which is why I don't feel comfortable being a Gen Zer, but Gen Zers are, right? And specifically apps like TikTok and Instagram, where well over 80% of the people are Gen Y, Gen Zers. And, you can compare that to Facebook, it's more of like a 50-50 split. My point being, if we as a community take time in investing in, being active on these apps with younger people where Gen Z and Gen Y are, we'll find that, the field and the audience will grow automatically. Another thing though is just, I just want to discuss like where we're putting the money in, in these apps. Are we, throwing money at advertising, or are we, working to with influencers, sponsoring influencers and content producers to, make things for the longevity community? Google tells us that from 2020 to 2025, the influencer market is going to quadruple. So, it might be smart for the longevity community to, get in there and sponsor and produce some of these influencers, and not only, they don't need to be producing content on, the science of longevity, but having, a company's name in some Instagram or TikToker's bio actually has a lot of value. And so, I think we can make a big difference there just by getting our name out there, companies and different institutions' names out there, just to spread the word on social media like that. Because if we're really going to, aim for the younger generation, that's where we need to be. We need to be on social media, and, not only just social media, their social media platforms. So. Yeah.
And I think it's an important point. But as someone kind of in this world of trying to at least spread messages at scale, every conversation with every group and every cause and every company, people say, all right, we need to be on social media. And maybe this is just generational, but I think that the core thing is not the distribution mechanism, but the core thing is, what is the essence of the work? What's the goal? Certainly, how is that communicated? But what I've seen with a lot of organizations and movements that don't start there, that don't start with an incredible amount of kind of deep soul searching about who are we, what are we trying to achieve? You can definitely generate a lot of activity. But I do think, though, that finding that right balance between doing more soul searching, which I think that the fact that we're here, that we have this platform in this great conference, I think is important. But I do think that this is part of the natural, and I hope natural, evolution of this field, where the exciting science creates a sense of opportunity. And then there's a balance between the exciting new stuff and the stuff that we've known for a long time and we don't do it. And how do we frame what we're trying to achieve? And I think that there's still an opportunity. Even the name of this conference itself, Metabesity, Thomas knows what that is, but I think the general world doesn't understand that. So how do we think about that? And I think that once we have that framing and that sense of who we are at our core, then partnerships will begin to emerge that will be very, very natural. So I could imagine partnering with groups for older people like AARP, groups for younger people, people who are thinking about cross-generational support. I just think that once we answer that question of who are we, we'll be able to think more thoughtfully about how we build on that foundation. So maybe a last quick word from everybody before we wrap up, starting with you, Celine.
Yeah, I was just going to say, so on one thing I think, and maybe it goes to the last point that Dylan was bringing up, and also more broadly, something I think is really important is just like transparency in like what you're working on, why you're working on it, how you're working on it. People got really interested in Loyal and what I was doing initially because they were curious about a young woman working on aging for dogs and how she was doing it and like what this process looked like. Things like that are really genuine, that are also a bit more unique, have been very effective. I think a lot of people have learned about the aging thesis via just being more interested in the general ideas of like, how does one build a company?
Yeah, great. Hanadie?
Oh yeah, really want to also echo what kind of Dylan said earlier, that we need to get more influencers and celebrities to sort of endorse the movement, educate folks, because that will get ears to perk. And then also I think getting more scholarships, fellowships, programs, like I'm now kind of a founding fellow for the On Deck Longevity Fellowship, which has been wonderful, and just getting a global community and kind of these virtual centers that we can all meet and talk and help recruit each other and brainstorm great ways to influence the health span and longevity biotechnology space. And so I think those could be great ways to really get younger folks involved.
Wonderful. Alison.
Yes, we need clarity and message. Jamie, I think you hit it on the head. And if I'll say any last words is, write to your members of Congress, educate them on the clarity of what we're trying to get at. And that is one really good way to start just having more conversations, and write for broader audiences. I know in science, we want peer-reviewed journals, we want pubs, but Twitter, podcasts, blogs, I mean, any way you can talk to a broader audience and get a hook and experiment on creating and finding the clarity for our message is really important. And actually members of Congress will pay more attention.
That's great, Alison. Dylan, last word.
Yeah, so I would like to say the political stuff and that you just kind of discussed there, writing your representative, is exactly what A4LI is set up to do. And I'm shamelessly plugging my company right now, but it is what it is. If we want to really get into the minds of these Congress people, write constituents writing to their Congress people is very effective. And, we're putting on events to make that happen at A4LI. So, that's one thing. And then another thing is just, I know it's not just TikTok, and it's not going to be, just putting the names out there. It's going to be a mixture of all of these things. It's going to be a mixture of messaging and, visibility. And also, just as Celine said, as the science kind of progresses, people's eyes are going to open more and more, because the things that we're going to be able to do is going to be more and more amazing. So I'm excited for the future, and I'm very optimistic that, the Gen Z, Gen Y, Gen X, and boomers can all come together and get behind this important problem.
Well, I think that's great. I think we're all excited. I think everybody is more excited with the inclusion of these great younger voices. And as I was saying in our private conversation earlier, the way that this is going to work is like birds in flight. It doesn't mean that one group is always in the lead or another group is always in the lead. We have to have the best configuration of all of us to get where we're going. So thank you so much to all of you. And then Thomas, over to you.
Jamie, thanks so much. Jamie, Celine, Dylan, Alison, Hanadie. This is a great conversation, a great start, a lot of chat, information in the chat. We'll try to document this and carry the conversation forward. Adrian, I'm going to throw this over to you to get the Emerging Company Showcase started. Thanks, everyone.
Thank you so much. This was such a wonderful way to begin and end our conference. And that is with people so smart, so young, leading us. But I do have one little soapbox like Alison. I'm 73. There are 78 million baby boomers out there. Show them how wonderful life is. Show them that they should plan for their own aging, and maybe they will become more interested in their own aging. So I'm very excited about us taking leadership so that younger people can understand the beauty of being older.